Hello, and welcome to the series of our guideline videos for healthcare professionals. In this video, we are going to discuss various queries regarding Saudi licensing exams for different healthcare professionals, their step-by-step guidelines for Dataflow PSV, and professional classification via MUMARIS PLUS. These queries are: what is SCFHS? What are the general requirements for healthcare professionals? What is SMLE exam and how it is conducted? What is SDLE exam and how it is conducted? What is SNLE exam and how it is conducted? What is SPLE exam and how it is conducted? What is Saudi exam for physiotherapist and how it is conducted? How to complete Dataflow PSV for SCFHS. Step-by-step guideline. How to complete professional classification via MUMARIS PLUS. Step-by-step guideline. How to schedule SCFHS Prometric exam. How to check exam result. How Saudization is affecting health sector. This is Dr. Muhammad from Interface Medical Education, and I will try to answer all these queries in detail. So, keep watching this video till the end. I am sure that you will be able to understand many aspects related to Saudi licensing exam registration and its data flow process. Before starting this video, we would also like to invite you to watch many of our videos made for healthcare professionals. I will request you guys to subscribe to our channel, hit the bell icon, to enjoy more of such informative videos in future, and of course, if you like this video then, do not hesitate to hit the like button and send us your valuable comments. The Saudi Commission for Health Specialties, SCFHS, which regulates healthcare-related practices and accreditation at all levels in the Kingdom of Saudi Arabia. SCFHS evaluates local and international healthcare professionals in all specialties through administrating different licensing exams, such as SMLE, which is Saudi Medical Licensing Exam; SDLE, Saudi Dental Licensing Exam; SNLE, Saudi Nursing Licensing Exam; SPLE, Saudi Pharmacist Licensing Exam. We will be discussing each one of these exams in detail in this video. Generally, all healthcare professionals are required to have certain number of documents, as well as meet some general eligibility requirements. Like, a candidate should have degree or diploma. Make sure that your university or college is in the list of authorized institutions of Saudi Commission of Specialties. If your institution name is not in the list, then you are required to add the name in list through professional qualification process in MUMARIS Plus, and paying 300 riyals. We will discuss this process during MUMARIS registration part, later in this video. Secondly, internship or house job certificate, for doctors only. Mark sheet. Health or medical license from graduating country. If there is no authority providing registration certificate or license, then the candidate should submit an evidence document stating that there is no issuing authority in the country. We will be discussing this in MUMARIS section, later in this video. At least 1 year recent work experience outside KSA for IMGs. Passport size photograph in white background. Your passport. Make sure that it is not expiring within at least 6 to 8 months from the time of starting this process. Ensure that you have no gap in your professional practice before applying. Ensure that you have not been out of practice for 2 consecutive years or more, otherwise, being IMG, you will be considered ineligible. And lastly, medical report for applicants over 65 years of age. All doctors who are willing to practice medicine in Kingdom of Saudi Arabia either as general practitioner or specialist are required to pass this Saudi Medical Licensing Exam, SMLE. This exam can be taken worldwide through Prometric centers. For general practitioner, this is a lengthy exam, consisting upon 6 hours, and divided into 3 sections. Each section contains 100 questions, with a total of 120 minutes duration. You can take 2 scheduled breaks between Section 1 and 2, and Section 2 and 3, with a pooled total time of 45 minutes. To be divided between these 2 breaks, based on your preference. This is the general breakup for different sections in SMLE exam. First section is of internal medicine MCQs, which is relatively tougher than the remaining 2 sections. Therefore, don't get stressed if you are not doing well in this section. Second and third sections of gynecology and surgery can be relatively easy if you are prepared well. You should try to achieve 70% passing score as a whole in these sections. The higher you score, the better your chances of matching into your desired specialty. After obtaining a pass score in the SMLE, each candidate is eligible for 2 further attempts to improve their marks for the purpose of attaining a better opportunity for residency selection. Saudi licensing exam for specialties, such as OBS and Gynae, general surgery, internal medicine, family medicine, pediatrics, cardiology, dermatology, and others, consists upon specialty-related questions. Each of these specialty exam consists upon 200 MCQs with 4 hours duration, having passing score of 60% for registrar, and 70% for senior registrar. All dentists who are willing to practice dentistry in Kingdom of Saudi Arabia either as general dentist or specialist are required to pass this Saudi dental licensing exam, SDLE. This exam can be taken worldwide through Prometric centers. For general dentist, this is a lengthy exam, consisting upon 6 hours and divided into 3 sections. Each section contains 100 questions, with a total of 120 minutes duration. You can take 2 scheduled breaks between Section 1-2 and Section 2-3 with a pooled total time of 45 minutes, to be divided between these 2 breaks, based on your preference. This is the general breakup for different sections in SDLE exam. First section contains questions from mainly endodontics, and some from orthodontics. Second section is of periodontics, implantology and surgery questions. And third section is of prosthodontics and bioethics. You should try to achieve 70% passing score as a whole in these sections. The higher you score, the better your chances of matching into your desired specialty. After obtaining a pass score in the SDLE, each candidate is eligible for 2 further attempts to improve their marks for the purpose of attaining a better opportunity for residency selection. Saudi licensing exam for specialties, such as endodontics, orthodontics, prosthodontics, pediatric dentistry, oral surgery and others, consists upon specialty-related questions. Each of these specialty exam consists upon 200 MCQs with 4 hours duration, having passing score of 60% for registrar and 70% for senior registrar. All nurses who are willing to work in Kingdom of Saudi Arabia are required to pass this Saudi nursing licensing exam, SNLE. This exam can be taken worldwide through Prometric centers. The SNLE consists upon 3 hours, and divided into 2 sections. Each section contains 75 questions, including 10 pilot questions. You can take a scheduled break of 15 minutes between the 2 sections. Passing score is 500 points, out of scaled score ranging from 200 to 800 points. The exam contains following percentage of questions from different topics. All pharmacists who are willing to practice as pharmacist in Kingdom of Saudi Arabia are required to pass this Saudi Pharmacist Licensing Exam, SPLE. This exam can be taken worldwide through Prometric centers. The SPLE is a lengthy exam, consisting upon 6 hours, and divided into 3 sections. Each section contains 100 questions, with a total of 120 minutes duration. You can take 2 scheduled breaks between Section 1 and 2, and Section 2 and 3, with a pool total time of 45 minutes, to be divided between these 2 breaks, based on your preference. Passing score is 530 points, out of scaled score ranging from 200 to 800 points. The exam contains following percentage of questions from different topics in 4 major pharmacy content areas. All candidates who are willing to practice as physiotherapist in Kingdom of Saudi Arabia are required to pass this Saudi licensing exam for physiotherapist. This exam can be taken worldwide through Prometric centers. This exam for physiotherapist consists upon 3 hours, and divided into 2 sections. Each section contains 75 questions, including 10 pilot questions. You can take a scheduled break of 15 minutes between the 2 sections. Passing score is about 60%. The exam contains following percentage of questions from different topics. Dataflow has recently introduced new application system for Saudi Commission for Health and Specialties SCFHS. Previously it was this website, where an applicant was required to start application process, for Dataflow PSV, primary source verification, but currently, applicant is required to start PSV process through visiting following website. Visit this website. If it is your first visit, then sign up through entering your valid email address. Agree the terms and conditions and confirm to proceed. You will receive account activation link at your email. Click at the link. Create a new password and confirm it. Now you are ready to log in. Enter your email, and enter your password on the next screen. Once you are inside your dashboard, you can start new application from here, or can check status of your existing application. This scale defines your application status. You can change the language from here. Now let's start your new application. On this licensing details page, please select authority name, which is in our case Saudi Commission for Health Specialties. You can see different health authorities' names here, so be careful while selecting authority name. While selecting application type, make sure you understand the terms. Additional means any document required per SCFHS's classification, for renewal. Let it be education, employment, or license document. Fresh graduate includes the verification of only one educational qualification, diploma, bachelor, master's, etc. Package includes the verification of one educational qualification, diploma, bachelor, master's, etc. One license, or employment certificate of recent 1 year at least. This type will give you the option to submit additional documents for verification if required. For a new application, let's select Package option. For case type field, please select the option accordingly. New means that you are applying for the first time under SCFHS. Renew means that you were previously licensed by SCFHS, and need to submit new documents for verification. Therefore, select New here. While selecting category if you are dentist, or doctor. Otherwise, for nurse, pharmacist, technician, dental assistant or other allied health services, select non-physician. Otherwise, please select physician option. Selection subcategory accordingly. While selecting service type, you may select regular service, where your PSV report may take 25 to 30 working days. You can also take other value-added services for application processing against service charges. You can find details through visiting this link. While selecting package, make sure you understand the type of documents you need to verify for yourself. Because, in some cases we have found, that candidates initiated data flow process through paying required fee, but while doing professional classification at MUMARIS Plus website, which we will do later in this video, they found themselves stuck when asked to upload health license. Therefore, make sure that you have all required documents, as we discussed earlier, before applying for this exam. Because, if you are IMG, and have 1 year working experience, then you should choose optional package, which verifies your degree, experience certificate, and health license. On the other hand, choose education and employment package, if you don't have health license, in the absence of any accredited health authority in your country, then you can submit your experience certificate instead. You will also be required to fill and sign the endorsement letter, during MUMARIS Plus step, which will be discussed later in this video. If you have more than one education degree to verify, then simply click this Add button, and additional cost will be added to your package. Select facility name of your employer from the list. If you don't have an employer in KSA yet, then select this option. If your employer health facility name is not available in this list, then click Other Facility option, and insert your facility details manually. Read the terms and conditions, agree with them and click Next button. You may change the Dataflow service plan from here, or continue with the existing service. Review the following information, and click Add OK button. On Personal Details page, upload your clear scan passport copy. If failed after trying again, then manually provide your correct passport information, and submit. Provide your correct mobile number to receive OTP code. Once received, validate the received code like this. Then click Next to proceed. On Verification Details page, start filling your health license details. Fill out all required information with correct details. While clicking at License Issuing Authority name field, it contains pre-populated data, which may contain the name of your licensing issuing authority. If you cannot find your issuing authority, then you can click at the link, I cannot find my issuing authority from the list, and provide details manually. Otherwise, select the name, and accept the terms through clicking here, and click at Submit button. Fill out all required details marked with red asterisk on this page. Upload the required license. Click at Next button to continue. On Employment page, while clicking at Name of Employer field, it contains pre-populated data which may contain the name of your employer. If you cannot find your employing facility name in this list, then you can click at the link I cannot find my issuing authority from the list, and provide details manually. Otherwise select the name, and accept the terms through clicking here, and click at Submit button. Fill out rest of the required information. Upload the required experience certificate. For multiple employment verification, repeat the same process. On Education section page, please provide correct information. While clicking at Degree Issuing Authority name field, it contains pre-populated data which may contain the name of your issuing authority. If you cannot find your issuing authority name in this list, then you can click at the link I cannot find my issuing authority from the list, then provide details manually. Otherwise select the name, and accept the terms through clicking here, and click at Submit button. Fill out rest of the required information. Upload the required educational document. And click at Next button. In Letter of Authorization section, consent it to digitally sign this letter. You can also download it for your record. Click at Finish button to end this application process, and now you can review your provided information. For any required changes, you may click at this edit link. You may download this entire application for future reference from here. Once satisfied with the information, click Submit Application button. Review payment details, select payment method, and then click Submit Application button. Once your payment is successfully completed, then Dataflow will send you a payment receipt at your email address. Once your Dataflow PSV report is completed, then Dataflow Group will make this report available to SCFHS. Once your Dataflow PSV report is successfully completed, Then you will be issued a reference number along with verification report in PDF format. You will need this later once you start uploading your documents in MUMARIS PLUS. Once your Dataflow PSV is successfully completed, and you have received Dataflow reference number with the report in PDF format, then you may proceed to MUMARIS Plus portal, which is a unified service portal for all healthcare professionals willing to apply for professionals classification service from inside or outside Kingdom, or avail other healthcare e-services in Kingdom of Saudi Arabia. For new applicant, sign up from here. Accept the disclaimer. Fill out all details and click Sign Up button. You will receive account activation email from MUMARIS Plus. Click on Activate Account button. Once your email is verified, then you will be able to log in from here. Upon your first time login to MUMARIS Plus dashboard, you will be intimated to complete your profile. First, select if you are a Saudi national, or a Iqama holder, which is visa holder, then click Yes. As we are applying from outside KSA, therefore we will select No, and click Continue button. Update your personal information accordingly and click Save button. To proceed to Professionals Classification Service, click on My Services link. Based upon your status on this portal, you will be automatically recommended to apply for professional classification. Click on this. These are the professional classification steps, which need to be completed. You can find more details regarding required documents and service cost for different healthcare professionals. To start service, click on Apply Now button. As we discussed earlier in this video, during initial requirement step, that international medical graduates IMGs cannot be eligible, if out of practice for 2 consecutive years or more. Only Saudi nationals can overcome this practicing gap through applying for SCFHS training letter. Therefore, select No option. Select Yes, as SCFHS qualifications list also include your qualification. Go through to Terms and Conditions. Answer the declaration questions accordingly and click at Apply for Service button. As you have already completed personal information section, otherwise you will see mandatory tag like this. To complete your personal information, click here. Make sure your provided information is as per the information available on your passport. All required information is marked with red asterisk on this page. You may leave this, as it is optional. Provide rest of the required information and click on Save button. Upload your photograph from here. Follow the on-screen instruction, and upload it from here. Adjust and crop it, and click Save button. Now, to upload your passport information, click here. Provide required information. Make sure that it should not be expiring within at least 6 months of applying for exam. Upload clear scan copy, and click Save button. If you are required to provide additional personal document, then you may do it from here. Otherwise, click on this button. Once your personal information is completed, then you can add qualification from here. You can always go to previous step from here, and make any required changes. You can also click here to save and continue later your service, and resume it through clicking here. Now, add qualification. Provide all required information. If your qualification rewarding authority is not in this list, then you are required to start application for new qualification study, through following these steps. Coming back to Add New Qualification page. Upload your degree or diploma. Upload transcript or mark sheet. Now, provide Dataflow reference number and upload PSV report which you have already received, as we discussed earlier in this video. In the end, click Save button. If you are required to add more qualification, then you may do it from here, otherwise, you can click here. In Work Experience section, click here to add work experience details as well as required documents. Provide your most recent experience, fill all required details, upload experience certificate, and click Add button. To add your professional license, click here. Fill out and upload required information. Provide data flow reference number and upload PSV report again. If there is no official organization which issues health license in your country, then check this box. In this case, you must upload authority letter like this. Otherwise, uncheck this box, and click Add button once provided complete information on this page. You can add more work experience from here, or go to next section from here. In Application Details section, provide required details. If you have already attempted this Prometric exam, then select Yes option, and provide eligibility ID which you may have been issued previously. Upload your result document. Otherwise, select No option, and click here to go to Application Summary. Please review your provided details carefully. You can always go back to any section from here. Otherwise, click here for Payment. Select Payment Method, and provide your payment details. Once your payment is successfully completed, then you will be notified accordingly and your application status will also be updated here as under review. It may take up to 2 to 3 weeks by Saudi Council to update you about the status of your application. Once your professional classification is approved by Saudi Council, then you will be issued an eligibility ID, and further details regarding registering for the Prometric exam. Once your professional classification is approved by Saudi Council, then you will receive an email containing your newly issued eligibility ID, and further details regarding registering for the Prometric exam. To locate nearest Prometric Center, schedule exam, and exam day guidelines, kindly watch our DHA Prometric exam video, especially the timeline starting from 4 minutes and 58 seconds. To check your Prometric exam result, which is posted on SCFHS website within 7 to 10 working days after taking exam, simply visit SCFHS official website, click at Practitioner, click Exams. Now click this exam result. To log in, simply enter your eligibility number here, and first 4 characters of your last name in this field. Click on Search button. Click on Statement Report button to download your result. Once downloaded, you can see the final result here. Kingdom of Saudi Arabia is currently passing through a transformational phase, implementing many policies, long been planned for the welfare of their citizens. Through Saudization, they are prioritizing their locals in different sectors. Healthcare sector is also seeing 60% allocation of jobs for locals, which is a good news for local medical graduates. On the other hand, it has reduced the inflow of healthcare professionals from around the world, especially from India, Pakistan, and Bangladesh to the kingdom. There is a myth among healthcare professionals that kingdom is no longer a good choice for IMGs, due to job insecurity, but this is not true for all healthcare professionals. Private healthcare sector is still offering lucrative packages for IMGs, especially for doctors, and will remain attractive for Pakistanis, Indians and Bangladeshi doctors till 2030, due to demand and supply gap, as well as profit-related issues by private healthcare sector. That's all from us. Hopefully this video will be beneficial for you, and will clarify many of your questions related to SCFHS data flow process, MUMARIS Plus registration, till scheduling Prometric exam. Do not forget to watch many of our videos made for healthcare professionals. Hopefully, you may have liked this video, then, do not forget to hit the like button. Share, comment, and subscribe to our channel. Have a good day, bye.